Hi, everyone. We're just going to give folks a few minutes to join, and we'll get started on today's MassHealth the Basics webinar shortly. Hi, everyone. Welcome to the Massachusetts Medicaid Policy Institute's webinar on MassHealth the Basics. We're just giving folks a few minutes to log in and get settled, and we'll start this webinar shortly. Okay, I think we will kick things off now. Hi, everyone. Thank you so much for joining us today. Welcome to the Massachusetts Medicaid Policy Institute's webinar on MassHealth the Basics. I'm Catherine Howitt. I'm the director of the Massachusetts Medicaid Policy Institute at the Blue Cross Blue Shield of Massachusetts Foundation. The Massachusetts Medicaid Policy Institute, or MMPI, aims to promote the development of effective Medicaid policy solutions through research and policy analysis. We also work to broaden public understanding of MassHealth and the important role it plays in providing coverage and in advancing equity. Our goal for today's webinar is to give you basic background information to help you better understand the MassHealth program. We'll also try to explain how MassHealth helps advance some of Massachusetts' statewide priorities, including improving care, reducing costs, and improving health equity. So before we jump into all of that, I do want to start by going over a couple housekeeping items. You'll notice that we're using the mute feature on the audio line during this webinar, and that's just to help reduce background noises. That said, we do encourage your participation, and we'll be taking questions throughout the presentation via the Q&A feature. So to submit a question, please click on the Q&A icon located at the bottom of the Zoom window. This webinar is being recorded, and in the next few days, you'll receive a link to the recording and a copy of the webinar slides. These will also be available on the Foundation's website. I also want to note that staff from the Foundation are available to present the basics of MassHealth to individual organizations. So if that's of interest to you, please reach out to me. My contact information is on the last slide of the deck, and it will also be posted in the chat. Okay, let's jump into this. So today I'm joined by my colleague, Jesse Gottsagen. Jesse is the Senior Policy and Research Analyst at the Blue Cross Blue Shield of Massachusetts Foundation. During this webinar, Jesse and I will review many of the charts that were featured in the October 2024 update of MassHealth the Basics. That chart pack was developed through a collaboration between 4Health Consulting at UMass Chan Medical School and Bob Seifert, an independent consultant, with the support of MMPI. The main presentation today is divided into a few different sections, including eligibility and enrollment, benefits and delivery systems, spending and cost drivers, and reforms to MassHealth. To give us an indication of how effectively we're delivering this information to you, we're going to be asking you to answer some poll questions throughout this webinar. These will test your prior knowledge of some of the issues we'll be discussing today, and then we'll ask you to answer the same questions again at the end of the webinar. I don't want you to stress about this, though, because responses are anonymous. So if you don't know the answer, just take your best guess. So we're going to start with one of those questions right now. The question should pop up on your screen shortly. Here it is. So as you'll see, it has multiple choice answers. So the question reads, what portion of Massachusetts residents are covered by MassHealth? Is it nearly 1 in 10? Is it nearly 1 in 5? Is it nearly 1 in 3, or is it half of Massachusetts residents that are covered by MassHealth? I can see the answers starting to come in here. This is great. I'll give you a few more moments to respond. Okay, it looks like responses are starting to slow, so I think we'll end the poll now. And just want to thank you all for taking the time to answer the question. You'll see 2 more questions like this throughout the webinar, and then we'll repeat the questions at the end of the webinar, and we'll provide you the answers then. So now let's just jump right into that webinar. So let's start by defining MassHealth. MassHealth is Massachusetts' name for 2 health insurance programs combined, Medicaid and the Children's Health Insurance Program, or CHIP. Both of these are public health insurance programs that are jointly funded by the state and the federal governments. Just over 2 million Massachusetts residents are covered by MassHealth, including many children, people living with disabilities, and seniors. People qualify for the program based primarily on their income. So most adults under the age of 65 can be covered if their annual household income is below 138% of the federal poverty level, which is about $21,000 for an individual. For adults over the age of 65, many of whom also have Medicare coverage, they typically have a slightly lower income cutoff, and they're also subject to asset limits. Most children have a higher income cutoff, so they're eligible for coverage if their family income is at or below 300% of the federal poverty level, or about $77,500 for a family of 3. Finally, MassHealth provides coverage to people with disabilities at any income level, though members pay a premium at higher income levels. This is really important because MassHealth offers benefits and supports to people with disabilities that are not typically available from other types of health insurance like Medicare or employer-sponsored health plans, and we'll dive more deeply into that in a few moments. So why is MassHealth such a critical program in the Commonwealth? First, MassHealth plays an essential part in the state's high rate of insurance coverage. It makes health insurance coverage possible for people who would not otherwise have it, either because their employer doesn't offer it or because they can't afford to pay for it themselves. MassHealth brings its members not just access to healthcare and better health outcomes, but also protection from the financial burdens of medical debt. Second, MassHealth is a critical part of the state's social safety net. A good illustration of this occurred during the COVID-19 pandemic, when employment dropped significantly, but coverage rates in the state remained high, in large part because of MassHealth. Third, MassHealth addresses health inequities by making coverage available to its diverse membership, and also by designing programs that target specific health disparities. And fourth, MassHealth has long been an engine of innovation in the state's healthcare system. Today, MassHealth is refining service models that address, for example, social determinants of health, like food and housing, and also approaches to paying providers in a way that rewards performance rather than just volume of services. So with that as the introduction, let's now take a deeper dive onto who MassHealth members are. So in state fiscal year 2023, which ran from July 2020 through June 2023, there were nearly 2.4 million MassHealth members. More than 1/3 of those MassHealth members are children. 56% are adults under the age of 65, and 1 in 10 are people age 65 and older. Only 9% of those older adults live in facilities like nursing homes. The rest of them live in the community. And 13% of MassHealth members are people with disabilities, most of whom are adults. MassHealth is it's a really important source of health insurance for particular groups in the Commonwealth. So for example, half of all children and 2/3 of people in low-income families in the Commonwealth are MassHealth members. Also, a majority of people with disabilities requiring assistance with their self-care, and 7 in 10 nursing facility residents rely on MassHealth for their health insurance coverage. MassHealth also plays a critical role in covering the low-income workforce in Massachusetts. Over 3/4 of MassHealth members live in working families, where a person working as a waitress, a cashier, a home health aide, or another low-paying job might not have access to employer-sponsored insurance, either for their family or even just for themselves. Or they might not be able to afford their share of the premium for the health insurance coverage that is available to them. MassHealth enables many low-income workers to stay healthy and in the workforce. So now let's look at MassHealth's enrollment trends over time. Overall, MassHealth enrollment grew steadily and rapidly in the years after 2020, following a period of relative enrollment stability between 2015 and 2020. That recent growth in enrollment coincides with the years of the COVID-19 pandemic. During that time, Massachusetts residents lost coverage from other sources early in the pandemic. But fortunately, the federal government stepped up with additional financial support to help state Medicaid programs, including MassHealth, absorb the additional enrollment. But as a condition of this funding, states were required to provide continuous coverage to members. That meant that MassHealth suspended its usual practice of redetermining members' eligibility at least once a year. So members who may have otherwise lost their coverage during the redetermination process instead stayed enrolled. As a result, MassHealth enrollment reached unprecedented levels before the continuous coverage mandate ended in April of 2023. Over the next year, MassHealth redetermined eligibility for all of its members. This was a process that was known as, and we refer to as the unwinding. At the end of the unwinding, enrollment stood 16% lower than at its peak at just over 2 million members, but it was still higher than it was at the start of the pandemic. With the unwinding process complete and redeterminations proceeding again in an orderly and scheduled way, we might expect to see MassHealth enrollment return to its pre-pandemic stability. Okay, so that's the end of our section on eligibility and enrollment, and I want to pause here for questions. So I encourage you to submit your questions using the Q&A button at the bottom of your screen. And I'm just looking through, let's see, the questions that we've received so far. Okay, I think I see a question here, somebody wanting to ask us to go into a little bit more detail about who lost coverage during the unwinding and what impact that may have had on the state's insurance rates. So we can't answer this question with a ton of specificity. What I can say is that when you look at MassHealth reports on the unwinding experience, it's clear that about 1/3 of the people who were disenrolled from MassHealth during that time were disenrolled because MassHealth was able to confirm that they were ineligible. The other 2/3 of people who lost coverage during the unwinding were disenrolled because there was just insufficient information to make a determination about whether they were still eligible. This likely included many people who didn't respond to MassHealth's notices and other outreach because they knew they were no longer eligible or because they may have even already had other coverage. But it also almost certainly included some who were still eligible but just didn't receive or weren't able to respond to the notices for additional information. One thing that we can say from MassHealth's reports is that the disenrollment rate for children, which was about, I think, 8%, was the lowest disenrollment rate of any age group among MassHealth members, and it was much lower than the disenrollment rate for children in many other states. As for how the unwinding impacted the rate of insurance coverage in Massachusetts, that's something we really can't speak to yet, and that's because the surveys that give us that information are just not yet available for 2024. Okay, I see that a bunch of more questions are coming in. This is great, and we're going to take more questions at the end of the next section, so keep those coming in. But I want to move us on for the interest of time. And before I turn it back to my colleague Jessie to walk through the material in the next section, I do want to introduce one more survey question. So remember, your responses to this are anonymous. Just make it your best guess, and it's okay if you aren't sure. Just make your best guess. So this question asks, what portion of MassHealth members is enrolled in a managed care plan? And just note that managed care includes people who are enrolled in an accountable care organization or ACO and other forms of managed care. Is it no MassHealth members enrolled in a managed care plan, a third, around a half, or over 2/3 of members enrolled in a managed care plan? I see those answers are coming in. This is great. Keep them coming. Okay. This is great. Okay, I think things are slowing down now, so we will end the poll, but I really appreciate everyone taking the time to answer this question. And again, we will ask this question again at the end of the webinar, and we'll review the answers at the end of the webinar. So I'm now going to turn it over to Jessie to discuss the services covered by MassHealth and the care delivery systems through which MassHealth members receive their services. Thanks, Jessie.
Great. Thank you so much, Catherine, and good afternoon, everyone. As Catherine mentioned, we're now going to turn to discuss a bit about the benefits and delivery systems in MassHealth. So now let's first look at the services MassHealth provides and how it provides them. Remember first that MassHealth is health insurance, in many ways similar to an employer-sponsored or commercial health plan. So in that way, MassHealth covers what a typical employer-sponsored plan covers, and that's things like hospitalizations, physician service, including child well visits, and prescription drugs. MassHealth is also a public program, one that serves many people with complex healthcare needs who would not be able to receive necessary treatment without it. MassHealth therefore also covers certain benefits that commercial insurance usually does not. These benefits include more extensive behavioral health services and oral health services as two examples. MassHealth also covers long-term services and supports, or LTSS, for most of its members. LTSS include facility-based care, so examples of that are stay in a nursing home, as well as supports provided in a member's home and community that make it possible for them to remain there. These home and community-based services include things like personal care attendants, adult day health, and home-delivered meals. LTSS needs vary significantly across MassHealth members, and there are many different types of services available to them to meet their specific needs. So another additional benefit that MassHealth provides is it now covers doula services for its pregnant, birthing, and postpartum members. Doulas can help reduce the likelihood of preterm births and low birth weights. They can also give birthing people a more positive birthing experience. In this way, doulas can play a role in reducing the racial and ethnic inequities, as well as inequities faced by other marginalized populations in both perinatal health and birth outcomes. Since this benefit was first introduced to MassHealth members last December, about 150 doulas have enrolled as MassHealth providers, and more than 700 MassHealth members have used this service. So the benefits I just described are those that MassHealth covers for most of its members, but not all MassHealth members receive exactly the same coverage. In fact, there are 5 distinct coverage types in the MassHealth program, and those are listed on this slide here. And a member's coverage type is determined by a few different factors, including, for example, their age, income, and immigration status. So the majority of members are in MassHealth Standard, which offers all of the benefits listed on the previous slide. A second coverage type, Common Health, has similar benefits to Standard and covers people with disabilities whose income exceeds the limit for Standard. Common Health members typically pay a premium on a sliding scale that's tied to their income. Care Plus covers adults with no children with income up to 138% of the federal poverty level. This group of people gained coverage through the Medicaid expansion under the Affordable Care Act. The benefits in Care Plus are also similar to Standard, except that Care Plus does not include LTSS coverage. There's also family assistance. This is another coverage type, and this is a category of coverage for people with higher family incomes, including adults with HIV/AIDS and children. Family assistance does not cover LTSS, nor does it cover non-emergency medical transportation. And the 5th coverage type within MassHealth is MassHealth Limited, which covers emergency services for people who are not eligible for broader benefits because of their immigration status. So as we just reviewed on the last slide, coverage types determine the benefits a MassHealth member is entitled to. And now we're going to shift to the topic of delivery systems, which determines how a member receives their care. So here, what we're going to focus in on this slide is sort of the primary distinction between managed care and fee-for-service, the two delivery system types. And there are several varieties of managed care that are tailored to certain age or disability categories. In fee-for-service, which is the public shaded part of this graphic, the purple shaded part of this graphic, MassHealth pays providers for each service they provide. So in this model, providers are rewarded for the amount of services they delivered and not based on their patients' health outcomes. In a fee-for-service system, no one is in charge of coordinating members' overall care across different providers. Because of these shortcomings of fee-for-service, MassHealth has over time moved more of its members to managed care, which is organized in a way that offers more coordinated and efficient care. As you see from the green and yellow shaded segments of this chart, 2/3 of all MassHealth members are now part of one of the managed care delivery systems. Most members who are under the age of 65 and do not have another source of insurance coverage are actually required to enroll in one of 3 managed care options, which are highlighted in the green in this chart. Those options are either an accountable care organization, or ACO, a managed care organization, or MCO, or the primary care clinician plan. Most members under age 65, and about half of all members overall, are enrolled in an ACO. There are 2 types of ACOs, and we'll go into a bit more detail about ACOs in just a moment. There is also some members with disabilities and members who are over age 65 who are enrolled in managed care programs designed to meet their particular needs. These options are highlighted in the orange and yellow sections of this chart. Individuals in these programs may be enrolled in both MassHealth and Medicare and are referred to as dual eligible. We'll review some of the special considerations for dual eligible members on a later slide. And so while we see from this chart that some dual eligible members are enrolled in a managed care plan, as I just mentioned, they also have the option to remain in fee-for-service, which is again highlighted in purple in this chart, and most of those members do remain in fee-for-service. So now let's talk a bit more about ACOs. Remember, the last slide showed that about half of all MassHealth members are enrolled in an ACO. So what is an ACO? ACOs are groups or organized groups of doctors, hospitals, and other healthcare providers that are held accountable for their members' health and healthcare costs. MassHealth offers 2 types of ACOs. The first is the Accountable Care Partnership Plan. As the name implies, these ACOs are partnerships of provider groups and health plans, which contract with MassHealth. The partnership plans are paid a set amount per member per month, regardless of how many services their members use. The ACO is at risk if the cost of their members' care exceeds that set monthly amount, and it also benefits if their costs are below that amount. The other ACO type is the primary care ACO, which is provider run and does not partner with a health plan. These plans pay their members' primary care providers a set monthly amount, creating similar incentives as in the partnership plans. For non-primary care services, such as specialty physician care and inpatient hospital care, MassHealth pays providers directly for each service. So for payments for these services, MassHealth set a spending target for the ACO in its contract. And the ACO then shares in either the savings or losses based on how their actual costs compare to their spending target. To balance the financial incentives to control costs that are built into the payment methods for both ACO types, ACOs also have payment incentives to increase the quality of care their members receive and to improve on their performance, identifying and reducing health inequities. Some members enrolled in ACOs and MCOs also have access to special enhanced services. For example, certain members with complex needs have access to entities called community partners to help coordinate their care. There are 2 types of community partners. There are behavioral health community partners. These are community-based organizations that work with members who have serious mental illness and addiction. The other type of community partners are LTSS community partners. They work with adults and children with physical and developmental disabilities and brain injuries. Another innovation that's available to a smaller number of ACO members is the Flexible Services Program. This program provides certain members with nutrition and housing supports. And this was done in recognition that members' health and healthcare costs are strongly influenced by health-related social needs. MassHealth requires each of the 17 ACOs to offer at least one nutrition program and one housing program. ACOs can set their own eligibility criteria for flexible services, but eligible members must demonstrate at least one health need and one risk factor, for example, unstable housing or food insecurity. ACOs are required to provide flexible supports to at least 1% of their enrollees. The Flexible Service Program is about to transition to a new model. So beginning in 2025, the program will become more standardized across ACOs with a MassHealth defined list of required services that ACOs must cover and supplemental services that ACOs can choose among. MassHealth is also setting standards for rates, member eligibility, and provider qualifications. So as was mentioned earlier, 1 in 5 MassHealth members are also enrolled in Medicare and are referred to as dual eligibles. We're now going to just spend a bit more time taking a deeper look at this group. These members typically carry 2 insurance cards and must navigate 2 distinct enrollment processes, provider networks, and sets of covered services. This can often cause confusion, suboptimal care, and worse health outcomes. So to address this, Massachusetts has 3 managed care options that aim to align Medicare and Medicaid benefits in one delivery system and coordinate these services for dually eligible individuals. Now going to just cover a bit more information about each of these 3 options. So the first is Senior Care Options, or SCO. This is a managed care program for people aged 65 and older. A SCO plan offers services that are covered by both Medicare and Medicaid, including LTSS and dental care. The second type, OneCare, is analogous to SCO, but is available for members below age 65 who have disabilities. And finally, we have PACE, the Program of All-Inclusive Care for the Elderly. This program enrolls members as young as age 55 who have a clinical need. It offers comprehensive services, many delivered at PACE centers, which are community sites that offer adult day services. They offer a health clinic, physical and occupational therapy, and common spaces for social and recreational activities. And again, as we mentioned earlier, fewer than 1/3 of MassHealth members who are also eligible for Medicare choose to enroll in one of these programs. The rest of the people in this group are in the fee-for-service system. So now that we've covered a bit about benefits and delivery systems within MassHealth, before moving on to the next section, we want to pause again to take 1 or 2 questions that have come in about the delivery system. Again, please use the Q&A button on your screen to submit a question, and we'll be taking questions now, but then also leave more time for questions at the end of the webinar. So I'm seeing a lot of really great questions come in. So one question I see here, this is a great question. It asks, does MassHealth charge copays or have deductibles? So this is an important question. And the answer here is that no, there are no deductibles in MassHealth. And as of April 1st of this year, there are no longer copayments either. So prior to April 1st, some members had copayments for prescription drugs, but since April 1st, these have now been eliminated as well. So the answer is no, no copays or deductibles. Okay, quite a few questions. Let's take this one. How are ACOs different from managed care organizations? This is a good question. So a key difference between the two is that managed care organizations are insurance companies and ACOs are provider-led organizations. So, and while there is one type of ACO that is a partnership between a provider organization and an insurer, the basic concept of the ACO is that it is provider-driven and accountable for the care of its members. Another difference between ACOs and managed care organizations in MassHealth is that only ACOs offer the flexible services program, which I described a few slides ago. And as a reminder, that program makes housing and food-related services available to certain numbers within ACOs, but those services are not available through managed care plans. And again, I see some really great questions coming in, but in the interest of time, I'm going to pause for now on questions, but please keep submitting them using the Q&A. We'll definitely get to more at the end of the webinar. And I'll now turn it back to Catherine, who's going to talk more about program spending. But before I do, let's complete our third and final survey question. And so this question, which I'm going to launch now, it asks, what portion of the state budget does spending for MassHealth represent after accounting for the federal revenues the program generates? So is it less than half of the state budget? Is it half of the state budget or more than half of the state budget? And again, please select and submit your answer and just take your best guess if you don't know. And we'll be reviewing these at the answers to these at the end of the webinar. Just give it another few seconds as more people submit responses. Okay, I see responses slowing down, so I'm going to end the poll and turn things back over to Catherine.
Great. Thank you so much, Jessie. Okay, so now we're going to turn to MassHealth spending and cost drivers. When it comes to MassHealth financing, the first thing that you need to know is that Massachusetts does not fund MassHealth on its own. The federal government is a really important financial partner. Most of the Medicaid portion of MassHealth expenditures for services are reimbursed at a federal matching rate of 50%. What that means is that for every dollar of MassHealth spending, the federal government typically reimburses the state 50 cents. But some MassHealth expenditures qualify for an even higher matching rate. So for example, the population that became eligible as a result of the Affordable Care Act's Medicaid expansions, for that population, the federal government contributes 90% of the program spending. Okay, so now you might be asking yourself, what percent of the state budget is spent on MassHealth? But the answer to that question, it requires a little explanation. MassHealth spending is a big budget item, but it is not as large a component of the state budget as it might first appear. And this is because MassHealth spending generates billions of dollars in federal revenue through the reimbursements that we were just discussing on that last slide. These revenues offset some of the spending and reduce MassHealth's actual impact on the state budget. And those federal revenues, they're substantial. So to give you a sense of their magnitude relative to the total state budget, in the current fiscal year, state fiscal year 2025, nearly 1/4 of the state's total budget is funded by federal revenues. And the vast majority of that federal revenue, about 86% or over $12 billion, it comes from the federal reimbursement of MassHealth spending. Much more MassHealth spending is offset by federal revenues than any other item in the budget. So to understand the true impact of MassHealth on the state budget, we look here in this chart at only the state spending that is not financed with federal revenues. Using that measure in state fiscal year 2025, MassHealth represents just 1/5 of state spending. So with that as context, let's now look at how MassHealth spending trends have changed over time. In current dollar terms, MassHealth spending increased 82% in the decade from 2014 to 2023, increasing from $11.9 billion to $21.7 billion. If you remove the effect of medical cost inflation, the average annual increase in spending over that decade was 4.4%. And MassHealth spending has increased rapidly since 2020, following what was actually a very stable period in MassHealth spending in the previous several years. And that increase since 2020, that was associated with the COVID-19 pandemic when, as we've already discussed, enrollment grew rapidly. What this chart does not show is that the increased spending was offset, at least in part, by enhanced federal match during that public health emergency. MassHealth enrollment has also declined substantially since 2023, so it's expected that spending growth will slow in 2024 as well. We can also look at the spending trend in terms of its components. So total spending, which is represented in gray on this graph, is driven by two primary factors. First, the number of enrollees in the program, which is represented in purple on this graph. And second, the average amount spent on each enrollee, which we sometimes call PMPM or per member per month spending. And that's represented in green on this graph. So this chart shows clearly that enrollment was driving total MassHealth spending increases in those pandemic years of 2020 to 2023, as the PMPM spending was actually pretty flat. And while overall per member spending is a useful concept for analyzing spending drivers, that number does mask a lot of variation in per member spending across different population groups that are enrolled in MassHealth. So for example, people with disabilities in yellow in this chart, and adults over the age of 65 in the red and orange color on this chart, they tend to have greater healthcare needs than other MassHealth members. So these two categories of members account for more than half of MassHealth spending, even though they represent less than a quarter of all MassHealth members. Many of the services that people in these groups receive are the ones that we talked about earlier, which are not available through other types of insurance coverage, like employer-sponsored insurance and Medicare. One of the most important and also most expensive of these is long-term services and supports. The trend in Massachusetts and across the country towards accountable, integrated, and coordinated care means that an increasing share of MassHealth payments are tied to, are made to health plans in the form of capitation payments, rather than as individual payments to providers for each service that a member receives. Capitation payments are monthly payments that MassHealth makes to a managed care entity like an ACO. The capitation payment is a set fee per member per month that does not vary or depend on the services that a member uses in that given month. The managed care plans are then accountable for managing the healthcare of their enrollees using those capitation payments. So in state fiscal year 2023, as you can see in this chart, more than half of MassHealth spending was on capitation payments. So that's the yellow part of the chart. In terms of the purple side, a large portion of that, or about 43% of that purple side, which is the fee for service payments that are made for specific care or specific services that are delivered, 43% of that were for long-term services and supports. This is because most LTSS services are paid fee for service, even for most members who are enrolled in ACOs and other managed care arrangements. The one exception to that, or I guess three exceptions to that, are SCO, OneCare, and PACE. MassHealth includes LTSS in the capitation rates they pay in those programs, but as Jesse noted earlier, they have relatively low enrollment compared to the other MassHealth managed care programs. For one more perspective on spending, let's look quickly at providers. As we mentioned earlier, MassHealth is a big source of revenue for many types of providers in the Commonwealth. Nursing facilities as a group receive more than half of their revenues from MassHealth. Community health centers and community-based LTSS providers receive nearly half of their revenues from MassHealth, and hospitals receive nearly $1.05 from MassHealth. So that wraps up the spending section of the webinar. I'm going to pause briefly to take probably just one question, and then move it on to Jesse for the last section of the webinar. And after that, we'll take more questions. I saw a bunch of questions. Let me see if I can find it. Yeah, I saw a bunch of questions come in, but one here, do you anticipate any potential policy changes under the new Trump administration that could impact MassHealth, basically? So yeah, this is such an important question. It's one we're doing a lot of thinking on right now. And the short answer is that we don't know anything for certain yet. Neither President-elect Trump nor most of the newly elected senators or congresspeople really addressed Medicaid or CHIP much at all during their campaigns. But there are two key areas that we are watching really closely. So one of those is Medicaid financing, and the other is the MassHealth waiver. So starting with Medicaid financing, we know that a major initiative of the Trump administration and of Congress in 2025 will be tax reform. Specifically, they hope to extend some of the tax cuts that Trump signed into law in his first presidency that would otherwise be expiring at the end of 2025. They may also hope to enact some of the new tax cuts that Trump ran on in his campaign, such as not taxing tips or overtime. We have heard that Trump's team and congressional leadership are eyeing cuts to Medicaid as a potential way to help finance some of those tax cuts. While we can't say with any certainty what form those potential cuts might take, we know that in proposed budgets and legislation from previous years, Trump and congressional Republicans have proposed a variety of Medicaid cuts. These have included various forms of essentially capping and then cutting the federal Medicaid funding that is available for states. And another prominent policy proposal is to reduce the federal matching rate for the Medicaid expansion population, which, as I discussed on an earlier slide, that's the highest federal matching rate at 90%. So each of these different proposals would significantly limit the federal funding available to help support state Medicaid programs and would essentially push significant new costs onto Massachusetts, as well as onto other states. And the second area that we're watching closely that I'll just try to cover very, very quickly is MassHealth's waiver. And I know Jessie's about to dive into that actually in a lot more detail in her next section. But most of MassHealth operates under waivers, which are granted at the discretion of the Secretary of the Federal Department of Health and Human Services. The MassHealth waiver has been in effect for nearly 30 years. So the current iteration of this waiver, it goes through the end of 2027. So it will need to be renewed under the Trump administration. So a possible scenario is that the Department of Health and Human Services would negotiate with Massachusetts to include changes that reflect the administration's philosophy and priorities into our waiver. Though again, at this stage, it's really premature to say exactly what that might look like. So again, big picture is we don't know exactly what the recent election results will mean for MassHealth, but those are two areas that we're watching closely, Medicaid financing and the MassHealth waiver. And that actually takes us very nicely into the next section where Jessie's going to be talking us through waivers and some of the other significant recent reforms to MassHealth.
Great. Thank you, Catherine. So before we dive into MassHealth's recent reforms, we need to first review sort of what a Medicaid waiver is. As Catherine just referenced in her response to that last question, a waiver is permission from the federal government to deviate from Medicaid rules to test program innovations or to gain more program flexibility to benefit members. Massachusetts, again, as Catherine mentioned, administers most of MassHealth through waivers. The waiver that affects most MassHealth members is the 1115 demonstration, named for the section of the federal Medicaid law that authorizes this type of federal waiver. This Massachusetts waiver first took effect in 1997, and since then, the state has used the waiver as a vehicle to both expand coverage, support the safety net, and provide incentives for delivery system innovations. States must ask the federal government to reauthorize their waivers. This is usually every 5 years. And the latest iteration of this waiver began in October 2022 and will extend through December 2027. So this version of the 1115 waiver builds on the ACO program and has a strong emphasis on improving health equity. A few examples for how it is doing this. So the latest waiver creates financial incentives for hospitals to identify and reduce health inequities. The waiver also tackles health inequities by expanding programs that are intended to address members' health-related social needs. such as housing and nutrition, that, as we know, are at the heart of many health inequities. In addition to these priorities, the new waiver updates eligibility policies to reduce the number of people who fall on and off of MassHealth coverage. So, for example, it permits MassHealth to offer 24-month continuous coverage for people experiencing homelessness. And what this means is that once someone experiencing homelessness has been determined eligible for MassHealth, they will retain their eligibility for 24 months, regardless of changes in their circumstances. So while demonstration waivers typically last 5 years before they must be reauthorized, a state may also propose amendments to existing waivers at any time. And in April of this year, MassHealth received federal approval for a major package of waiver amendments that expand coverage and stabilize eligibility for certain groups. One of those amendments addresses the so-called Medicaid inmate exclusion policy, which prohibits the use of federal Medicaid dollars to cover people who are in jails and prisons. MassHealth's waiver now allows MassHealth to extend coverage for certain services for 90 days prior to someone's release from incarceration to support their transition back to the community. This waiver also gives MassHealth permission to provide 12-month continuous eligibility to all MassHealth adults, and this is something that had already been in place for children. Further extending eligibility, MassHealth will restore something known as retroactive eligibility to 3 months prior to the application date, starting July 1st, 2025. This means that when someone is determined eligible, they're covered for services they received up to 3 months before applying. And finally, recognizing the importance of stable housing to health, MassHealth may now cover up to 6 months of housing costs for certain at-risk groups, such as pregnant people and families with children experiencing homelessness who meet certain clinical criteria. So another important MassHealth innovation is its enhanced behavioral health benefits, which really help to fill gaps in the state's behavioral health infrastructure. So MassHealth has been a central element in the state's roadmap for behavioral health reform, which includes a broad set of reforms to Massachusetts' behavioral health delivery system. And actually, I do want to call out here, the foundation recently published a report that provides an overview and an update on the implementation of the state's roadmap. And I think we'll post a link to that publication in the chat. So one area where MassHealth is really taking a lead is in establishing and paying for its members' care at community behavioral health centers, or CBHCs. This is a new type of mental health and substance use disorder services provider. The creation of these new outpatient providers is expected to reduce the reliance on hospital, emergency, and inpatient departments for people in need of crisis behavioral health care services, as well as services for urgent and routine care. So at this time, we are going to shift to our last Q&A section of the webinar, and I'm going to bring Catherine back to help in answering remaining questions. Hi, Catherine. I'm going to bring her back, and then we're going to answer a few questions before she wraps us up.
Great. So I know we're short on time, and I want to get through as many of these questions as I can. So we were looking through, it looks like there are a lot of questions coming through about whether people with different immigration statuses can qualify for MassHealth, and if so, what form of MassHealth. So it's important to know that MassHealth benefits vary for non-citizens depending on people's specific immigration status. The coverage for non-citizens may also vary based on a number of other circumstances like age, family income, disability status, whether the person is pregnant, etc. So the coverage that a non-citizen can qualify for, it really ranges from full eligibility for all types of MassHealth coverage to much more limited eligibility for only MassHealth Limited and the health safety net. So there's actually, the Massachusetts law reform has a really informative guide on this topic, which I'm going to ask if Jesse might be able to post in the chat right now, so that you know where to go for further detailed information on this. Okay, next question. Somebody has said, I joined a bit late, but I was wondering if there's an income limit in order for someone to apply for MassHealth. So yes, income limits, MassHealth does have income limits for most populations, except people with disabilities who can qualify at any income, though they may have to pay premiums at higher income levels. And the income limits vary. For everyone else, income limits vary based on your age, your family status, and other circumstances. The general income eligibility standards are on this slide number 8 of the full basics slide deck, which you can find on the foundation's website. And I'm hoping one of my colleagues might be able to paste that into the chat here as well, so you can know where to look up income limits. Somebody here is asking, does MassHealth offer community-based assistance with applying or recertifying for MassHealth coverage? So yes, there are 2 community-based resources that come to mind for me that are helpful for people who are looking to apply for coverage. One is that Healthcare for All runs a helpline that is really a statewide multilingual phone service that helps Massachusetts residents at all income levels with enrolling into health insurance. They also, answer questions about insurance and troubleshoot cases. So you can call the helpline at 800-272-4232, and we'll try to get that number into the chat as well. There are also other community-based organizations that are designated as enrollment assisters. Enrollment assisters are trained and certified individuals at organizations in your area that can help you apply for coverage, shop for plans, answer your questions about eligibility, etc. And help from enrollment assisters is free for people at any income level. And we'll try to paste into the chat, and maybe Jesse will be able to paste this into the chat. There's a website where you can go to find enrollment assisters. And I'm just going to answer one more question, because then I know we need some time to wrap up. Somebody asked about the senior buy-in, how that fits in. So MassHealth pays for Medicare premiums, deductibles, and co-payments for people who are below a certain level. This is called the Medicare Savings Program, and it's often referred to as Medicare buy-in. This is available to older adults whose income exceeds the limits for Medicaid eligibility, but it does provide them with financial assistance so they're able to access all of the benefits that they're entitled to in Medicare. So there were so many other wonderful questions, and I regret that we're not able to cover them all, but I do need to wrap us up now. So I want to just review some of the key information that we covered on today's webinar. MassHealth currently covers nearly 1 in 3 Massachusetts residents. MassHealth enrollment grew substantially during the COVID-19 pandemic, in part because states paused their eligibility redeterminations during this period. But as eligibility redeterminations resumed, MassHealth enrollment declined 16%. Despite this decline, this enrollment, the current enrollment of 2 million members, nearly 1 in 3 Massachusetts residents, is still greater than pre-pandemic levels. The recent increase in MassHealth spending was driven primarily by that increase in enrollment during the pandemic. The increased spending was partially offset by increased federal revenues during the COVID public health emergency, and it's expected to level off now that enrollment has declined. And to understand the true impact of MassHealth on the state budget as a whole, it's important to look at state spending that is not financed with federal revenues. Using that measure, in state fiscal year 2025, MassHealth represents 1/5 of state spending. 1/5 of state spending is on MassHealth. Over 2/3 of MassHealth members are enrolled in one of the managed care delivery systems, with more than half of members enrolled in an accountable care organization. And recent reforms to MassHealth include strategies to improve health equity, including equity-related payment incentives for hospitals and ACOs, and shoring up the continuity of coverage for certain groups, like those in unstable housing situations, whose healthcare needs demand steady coverage. So before we go, let's see how we did in imparting this information. Please take a few seconds. We're going to pop back up those same 3 questions again that you already answered at the beginning of the webinar and throughout the webinar. So here's the first question. What portion of Massachusetts residents are covered by MassHealth? Nearly 1 in 10, nearly 1 in 5, nearly 1 in 3, or half? And we'll just give you a few moments to respond to this question. Wonderful. Okay, I think the answers are starting to slow, so we will move it to the next question now. We're just pulling that up. Okay, what portion of MassHealth members is enrolled in a managed care plan? And just a note that this includes people who are in accountable care organizations as well as other forms of managed care. Is it none? Is it a third? Is it a half? Or is it over 2/3 of MassHealth members that are enrolled in a managed care plan of some sort? Seeing the answers come in, this is wonderful. And they're starting to slow. So I think we will move us on to that final question. Great. What portion of the state budget does spending for MassHealth represent after accounting for the federal revenues that the program generates? Is it less than half, or more than half? Wonderful. Thank you all so much for taking the time to answer these questions. We really, really appreciate that. And I'll now just take a moment to review the answers to these questions. So we'll just go to the next slide. So the first question was, what portion of Massachusetts residents are covered by MassHealth? And the answer was nearly 1 in 3. Nearly 1 in 3 Massachusetts residents are currently covered by MassHealth. Second question, what portion of MassHealth members is enrolled in a managed care plan? And the answer is over 2/3. So most MassHealth members are enrolled in a managed care plan. That includes ACOs. Third question, what portion of the state budget does spending for MassHealth represent after accounting for the federal revenues the program generates? And the answer is less than half. Indeed, it's about 1/5 of the state budget after accounting for those federal revenues. Wonderful. So I'm just going to wrap us up now. I want to start by thanking you all for joining us today and also thanking my colleague, Jesse. You did a wonderful job, Jesse. Thank you so much. If you have any additional questions, and I know you do because I saw a lot of questions coming in that we weren't able to get to, we have provided our contact information on this last slide. You can also find the full MassHealth the Basics chart pack on our website. A link to a recording of today's webinar and the webinar slides will be emailed to you in the next few days and will also be posted on the Foundation's website. And if you would like staff from the Foundation to do a presentation of MassHealth the Basics at your event or for your organization, please reach out to me, Catherine, at my contact information on this slide. Thank you all so much for your time and your attention and your interest in this really important subject, and I hope you all have a wonderful day. Thank you.